It is a wonderful day, and I'm delighted to have the governor here with us on this day. I want to recognize Senator Whitehouse, Congressman Blanchard, and Congressman Cicilline. Senator Reid couldn't be with us, as well as representatives of the colleges and universities. Provost DeHanes is here on behalf of President Dooley. And it's really a day that I think many of us, and many who were involved in our work a year and a half ago, were probably not sure this day would come. I look at Mike, the head of the Hospital Association, who was like, is this really going to happen? It's finally really happening. And it's an exciting moment because this is an investment. So we're still going to pay claims the way we pay claims and the way that money flows through the system. But now, instead of just talking about how we pay for services, we're thinking about John. And we're thinking about how can we invest this added money to create the workforce, as the governor said, that is perhaps a little less traditional than it has been in the past, but is trained at our 3 colleges and universities to serve people in the community, serve people in their homes, to serve them in settings that meet their needs, and help to really provide preventive services, long-term care services, the very things we have talked about but have such a struggle investing in. And I want to thank CMS, part of our alphabet soup of healthcare, and Secretary Burwell, and certainly the governor for harassing Secretary Burwell very appropriately for us. But also, we are blessed with our federal delegation, who advocate very strongly for us as well. So we are now about to think in an even more concrete way about how we serve almost 1 in 3 Rhode Islanders more effectively. And I want to recognize Dennis Keefe and Ira Wilson, lost Ira, who chaired the Reinventing group, a challenging and exciting group to work with. Certainly want to recognize the colleges and universities. Many of my colleagues in the cabinet, because this was a cross, when you think about health, this crosses a lot. You can't put us in one little area, right? If you think about our families, health impacts so much. It impacts your work, it impacts your well-being, it impacts economic well-being. And when you think about government, we're crossing all of those areas as well. We have another big grant from the federal government, the State Innovation Grant, and we will be linking these resources together to maximize the potential. And I want to recognize my leadership down in Cranston. We labor down there, a little bit removed from the State House. Darren McDonald and Deb Florio, the Deputy Medicaid Directors, and I want to recognize Anya Rader-Wallach, who served very strongly as our Medicaid Director and has gone on to the Brown School of Public Health. But without their leadership, as well as the governors, we would not be standing here today. So we're bringing more than about $130 million in new investment to our state. And we will be investing. We will be investing creatively. And we will be talking about and working together to do that well. Think about things that we have pilots of right now. Community health teams, which are meeting people's needs in the community and can think about not just one type of care, but all types of care that an individual might need. John's story, where he needed some supports for his depression. He needed somebody to help him in his home. He needed to make sure he got his basic health care services. So many different areas, and how do we link them together? You all know, who are in this business, that we have a design and payment system that supports that. That's part of what we're going to be doing with these resources. And we'll be thinking about better care, healthier people, and smarter spending as we do it. So we're going to have alternative payment models, all the jargon of the moment. But let me talk about one piece of jargon that I think is particularly important in Rhode Island. That's our accountable entities. In the federal government, we call those accountable care organizations. And in Rhode Island, under the governor's leadership, we decided to pilot this as part of our Reinventing Medicaid. We said, let's try and get 25,000 Rhode Islanders enrolled in a coordinated system of care, where we in Medicaid will support that with our dollars. And in fact, we have 100,000 people enrolled over the past year, actually the past 8 months. And we're starting to say, okay, how can we fundamentally change the health of these people? We will be investing through those organizations in our community. And the federal government has said, yep, this is the way we want you to go. Coordinate care, meet people's needs in the community. Think about something that we have talked about for years in Rhode Island, which is, the governor mentioned it, how do we rebalance our system? How do we actually make it a reality that I can help care for someone in my family who would traditionally have been in a nursing home, and has been in the hospital, and we all know that's when you're most likely to end up in a nursing home is after a healthcare crisis. And how can we support and incentivize bringing that person home and having them live a full and healthy life surrounded by their family? These are enormous opportunities, and we will be partners getting it done. So having the federal government recognize our work and say they want to invest with us, and actually, wonderfully, they want to give us the money to invest, which in a state like ours where we have so many needs, to have the federal government say, we're recognizing that you have been investing in the workforce, and we want to recognize that by providing federal resources to match that. Many states have medical schools and other things that help them do this. We don't have a public system. But you're going to hear from some of the leaders in our colleges and universities about all of the healthcare workers of the future that they are currently training and how we're going to help them expand that. So there's so many exciting things about this funding, and it is going to really transform how we meet the needs of Rhode Islanders and improve their health. So often we think about the people who need so much, and it's important that we meet their needs. But I think it's also really important that we recognize the children and others who we want to have grow up healthy and who are born into Medicaid-supported health care, and we need to make sure live long and full lives, and hopefully are on their own private health insurance as they grow up healthy and strong into adulthood. So there are many opportunities.